We're in a crisis with chronic disease burden in this country and the county, as you're all aware. Some of the most recent statistics show that 75% of our healthcare dollar nationally goes to people with chronic conditions for a burden of $500 billion annually. With diabetes alone, the most recent data estimates that by 2020, half of Americans will have either diabetes or prediabetes. Childhood obesity, which has gotten so much press and we're all concerned about, there's a whole other level of burden. This is unfortunately the first generation in the United States that expects to have a shorter life expectancy than its parents. First time in U.S. history. Child obesity contribution to that is estimated to be a 2 to 5 year decrement in life expectancy attributable to childhood obesity. Again, preventable conditions. How are we doing in Monterey County? Sad to say, our statistics are actually worse than the state average for both diabetes and overweight obesity. 2009 statistics, our rate of diabetes in Monterey County is 11%. That went up from 8.5% in 2007. That was about a 30% increase. The state of California is about 8.5%. We're at 11%. The Latino population is 12.2%, and that increase was a 56% increase from the reports of 2007. California is 59% combined overweight and obese. Monterey County, we have a prevalence of 67% overweight and obese. And again, the Latino population is 76% combined overweight and obese. That increase was a 9% increase. So we're disproportionately heavy, obese, and diabetic, and disproportionately increasing as of the last few years. But health promotion is really the idea of keeping healthy people healthy. So trying to get to people to make changes that would prevent the initial onset of the chronic diseases we're talking about, lifestyle changes, behavior changes. So we have a vision of promoting health promotion by virtue of a center. And the way we intend to do this is starting with our diabetes education program, which we have experience running, using that as a hub, and then reaching out beyond that. So we want to get to the people not only who have diabetes, we want to serve them, of course, but who are the next at-risk people? People who have a relative with diabetes, a blood relative, have a higher chance of becoming diabetic themselves. Some of it's genetic, but some of it is things that we can intervene with, mostly nutrition and physical activity. We know that it works. We have data that shows national data, international data, and some local data that I'll mention, that intervention with intensive lifestyle change, small amounts of weight reduction, even 5 to 7%, if it's sustained, combined with increased physical activity, mostly walking 30 minutes a day for 5 days, can reduce the onset or delay the onset of diabetes by 58%. We want to incorporate a multidisciplinary team, so it's not just clinicians, but including diabetes educators, registered dietitians, but people who are health educators, health promoters, peer coaches. Most of the successful programs have shown that you need an array of people intersecting at different levels in a culturally appropriate way to help people overcome the daily obstacles that we all have with making long-term successful behavior change. We've been doing a local program here the last year. I've been privileged to be the teacher actually in it of a class that is a 5-week series, 2 hours per class. This is a food stamp eligible population, so we've been partnering with migrant ed parent groups, with low-income housing programs, and with food banks. Detailed interventions in nutrition and physical activity, and we have data that shows that it works, that people are eating more cups of fruits and vegetables every day, very quantifiable things. So we think it's timely and exciting at this point and novel for Monterey County to embark on a health promotion center. Timely because, as Harry mentioned, federal reform, state reform is telling us we have to do more with prevention. Health promotion has traditionally kind of been a middle class or upper middle class thing of wellness. People call it wellness sometimes too, going to the gym or coaching or to personal trainers. We think it's important that our patients, the safety net population, have access to prevention because they are actually disproportionately affected by the chronic disease burden more than the other populations. So we think the time is now. You as employers want a healthy workforce. We want a healthy, vibrant community. So this is why we're excited about health promotion. Thanks.